Hello, myself Neha Sagatia, and today's our topic is abnormal reflexes during stroke. So, first of all, what is stroke? Stroke is the blockage of blood supply to the brain. It is known as brain attack also. There are two types of stroke: ischemic stroke and hemorrhagic stroke. So today we are going to explain about abnormal reflexes seen during the stroke. First of all, there will be presence of flaccidity. In this state, there will be absence of reflexes, which will be termed as hyporeflexia. And in the later stages, flaccidity will be converted into spasticity, in which there will be reoccurrence of the reflexes, which will be termed as hyperreflexia, or also there will be deep tendon reflexes, which will go into hyperactive. And there, due to increase in spasticity, there will be clonus seen. It will be more in the Achilles tendon and wrist flexors. Okay, so now there will be release of primitive reflexes during stroke. There will be primitive reflexes seen during the birth or after the birth time, and it will be integrated at the months or years after the birth. There are many reflexes seen during the stroke. First is asymmetrical tonic neck reflex, in which there will be rotation of head towards one side, and there will be flexion of limbs towards which are towards the head side, and there will be extension of the limbs towards the jaw side. There is another one, symmetrical tonic neck reflex. In the symmetrical tonic neck reflex, there will be flexion. If there will be flexion of the head, there will be flexion of the upper extremity, and there will be extension of lower extremities. If there is the head extension, there will be extension of the upper extremities and flexion of the lower extremities. Symmetrical tonic labyrinthine reflex. In this reflex, when there will be in the supine position, there will be increase in the extension tone, and when there will be in the prone position, there will be increase in the flexor tone. Tonic lumbar reflex. In this reflex, there will be rotation of trunk towards the hemiplegic side over the pelvis, which will lead to flexion of lower extremities and extension of the upper extremities. Flexor withdrawal. When there will be stimulus applied towards the sole of the foot, there will be immediate hip knee flexion seen. In the positive supporting reaction, there will be pressure applied at the bottom of the foot, which will lead to lower limb gone into rigid like a pillar. There will be Babinski sign positive during the assessing of the plantar reflex, and there will be also associated reactions, which are the abnormal reactions seen in the hemiplegic patients. It is the response to the any particular movement. Higher level impairments, writing reactions. Writing reactions are the normal response to the managing the alignments of head, trunk and limbs. Equilibrium reactions. Equilibrium reactions are the response to any kind of fall, response to balance in the any kind of fall. Automatic adaptation of postural turn. In this, posture will maintain its tone by its own and prevent us from falling.